welcome to Healing Horizons, the space where wellness meets wisdom and the frontiers of health expand beyond the physical. I'm your host, Pragya, and today we are stepping into a conversation that might just change the way you think about healing. Joining us is Dr. Julius Torelli, a seasoned cardiologist who spent decades in the world of stethoscopes and prescriptions until he realized something was missing. His journey led him to something that led him to create the Gratefully Well method, a beautiful blend of medicine, mindset, and mindfulness. Here's a question for you. What if healing wasn't just in your prescription, but in your perception? Today, we explore how mindset and gratitude can rewrite the very language of health and maybe your story too. Let's dive in. Thank you, Julius. Thank you for being here.
Thank you very much. I appreciate the opportunity. I'm honored.
That's absolutely our honor, and I would love to start with you spent years and years practicing conventional cardiology. What was that defining moment when you really realized treating disease it wasn't enough, that healing had to include something more, that healing had to come in the way, and how did that lead to creating the Gratefully Well method? Can you just share about it?
Sure. It started actually at the very early in my education and training in the last week of medical school. So I had, literally was finishing my training, and I saw a patient who came in with 3 days of nausea and vomiting and dry heaves, very sick. And she was dehydrated. So we put her in the hospital. We gave her some fluids and we did some tests. And over a 3 day span, all the tests came back normal. She was starting to feel a little bit better. And I went to discharge her from the hospital. And while I was sitting there writing her discharge instructions, I was trying to make some small talk. And I said something corny like, well, we'll get you home now so you can get some real rest because you can't rest in the hospital. They're always bothering you. And she made a curious comment. She said, "Oh, I wish." And I thought to myself, that's an odd comment. I said, what do you mean you wish? She says, "I wish I could go home and get some rest." And I said, "Well, why can't you?" And she says, "Well, in the last 6 weeks, my husband left me, my house burned down, and my dog died." And in that instant, like, it became intuitively obvious to me why she was having nausea and vomiting and dry heaves. The foundation or the etiology of her symptoms became obvious. But so that was the first that was the first thought. The second thought was, wait a minute, you know, well, I'm finishing my training, my education, I should say, and I didn't learn anything about this entity that I'm thinking is causing her symptoms. So maybe I'm not right. Maybe that this is not an entity. And then, the third sort of thought was, well, I have a whole medical school library that is open to me, and I don't even know where to go in to read about this entity. So I was very confused. Was this something real or not? And if it was something real, how do you treat it? Uh, and so, but it was, the end of my medical school. I had to pack, and I was moving, and it was a very busy time. And so I did all that, but that patient stayed in my mind for forever. And as I went through my training then in internal medicine and then cardiology, I continued to see this type of symptoms. And then when I went into practice, I again started to notice that all of the visits that occur to physicians, it doesn't matter the specialty, primary care, cardiology, gastroenterology, neurology, what have you, Uh, Most of the people who come in with chronic complaints, we can't seem to really find anything physical that's causing those symptoms. So, in other words, in Western medicine, when you have an acute problem, like you break a leg or you have a belly pain and appendicitis or something like that, we're pretty good. Right? If you're having a heart attack, we can go in and stop it. But when these people come in with very common chronic complaints like headaches or belly pain or chest pain, and they're not having a heart attack, or back pain or chronic fatigue or muscle aches, frequently, and I would say most commonly, we don't find anything physical. So today we call those medically unexplained symptoms. So I think the poster childs for those are irritable bowel syndrome and migraine headaches. Most people who have migraine headaches don't have a brain tumor, right? If you scan their brain, you don't see anything. We understand the physiology, but there's nothing physical that's causing this issue. And so, but yet the medical profession very much, agrees that these are, quote, stress related. So I don't like that word stress. I call them emotionally related, but nonetheless, they have an emotional basis, and the medical community, would agree with that. But when we see these patients, we tend to just put them on. They don't need any surgery because there's nothing to operate on. So the only other thing in our toolbox is pharmaceuticals, and so we start putting them on medications. And if you have migraine headaches, today we have medications that are pretty good at preventing migraines. We have medicines that treat migraines and such, but they don't do anything for the foundational issue, which is these emotionally related sort of issues. They don't do anything to get at those foundations. And so gratefully well, or what happened in my practice was then I evolved into trying to figure out ways, because I didn't have any training, I didn't have any education. What do you do for these people? How do you treat them when you want to, you know, to help them? Because the doctors, even the ones giving medicines, they do want to help. They're just limited in what they can do. And so I started, looking at, what could be done. And so the way I thought of it was in the form of not what I called incorporating the non-physical dimensions of health into healthcare. So in Western medicine, we tend to focus 99.99% on the physical, because that's sort of what we can see, what we can measure, and what have you. And that's fine. If someone comes in with chest pain, the first thing that I would do as a cardiologist, make sure they're not having a heart attack. If they're not having a heart attack, you want to make sure they're not having the precursor to a heart attack, like unstable angina. But and if they are, you need to treat that, obviously. But if they're not, then frequently this is what we call non-cardiac chest pain. And so what do you do for that? And so that's when I would start to look at these non-physical dimensions of health, such as mental health, emotional, behavioral health, social aspects of health, cultural aspects of health, spiritual aspects of health, looking at these other aspects and incorporating those into the evaluation of a patient, and then the treatment. Does that make sense? It's a long-winded answer.
That actually was so great, and thank you for sharing that with us. Also, I really like the transition which you went through from treating diseases to supporting true healing. That is so right. Also, you mentioned that illness firsthand, like when it comes in front of the doctors and the treaters, when illness comes front of them, it's purely physical, but you've seen firsthand how mindset it really matters. So how does the way we think, our beliefs, our perception, how does that actually shape symptoms or even the course of an illness? How do you see?
So that's sort of where we start in the once we do the evaluation. Again, I want to emphasize that, the a Western approach with a physical approach is important. If you have belly pain, you want to make sure there's not something physical going on, like, some autoimmune disease like ulcerative colitis or Crohn's disease or appendicitis or something like that. Because if there's something physical going on, obviously you want to deal with that. And so that's first. Then if you don't find anything, right? So it's one of these medically unexplained kind of symptoms, then it becomes a bit of a challenge in our society because um, people, let's use migraine headaches as the example, right? Because that's one of the things we're talking about. So in migraine headaches, the patient first would rather you not find anything, right? Because if you find something, it's not going to be good if you have like a brain tumor or something. So they're actually kind of relieved when you don't find anything. So that's the first reaction. But the second reaction is, oh no, now they're going to think I'm making this up or that it's all in my head. And so you have to work to remove that concept or that thought. And so what I do is get them to understand there is a physiology to thoughts, that thoughts are powerful. Now, I use the term mindset because it translates better. Sometimes people understand it better than using beliefs or thoughts. But nonetheless, I think of them personally, mindset and beliefs and thoughts as synonymous. But a thought is powerful, right? And we don't really spend much time in medicine talking about what I call the physiology of thought. So simple example, right? Close your eyes, relax, picture a lemon, cut the lemon, and then picture yourself biting into that lemon. If you do that exercise, you will salivate. Now there's no lemon there. It's just the thought of the lemon that is making you salivate. Another example, it might be that you're going to sleep and you're in that space where you're just falling asleep and you hear a noise downstairs and you wake up, you're a little bit startled. So your heart's racing a little bit. Now you have the thought, maybe someone broke into my house. Now your heart starts racing more. If you measured your blood pressure would be up. Your pupils dilate so you can see better. Believe it or not, your sugar goes up. So this is sort of the fight or flight response, right? That autonomic nervous system sympathetic response. Now you go downstairs and you find that, something fell over, a broom fell over, knocked over some boxes maybe or something. And that's what the noise was. And you're relieved. Okay, no one broke in. So now you go lay back down and it takes a little while for all of that sympathetic nervous system to sort of calm down and realize, hey, nothing bad happened. That's great. But what happened there, right? Again, the physiology was was exactly the same. No one broke in, but yet your physiology was the same as if someone had broken in. So it's not someone breaking in that causes that physiologic change. It's the thought that caused the physiology, that physiology. So there's a biochemistry to thoughts. And we don't talk about that much in medicine. So it's very important for patients to understand that. Then once they understand that physiology, there's actually, hormones, neurotransmitters and such that get secreted from these thoughts. Then you can start to understand it. In addition to that, right, you have these thoughts. And what happens when you have thoughts of stress or anger or rage or frustration or irritation, anxiety? With these thoughts, you will tense your muscles. So if you tense, do an exercise where you tense your shoulders, shrug your shoulders and tense them for as long as you can, will start to hurt after a while because the muscles get tense and they ache. You have nerves that run through those muscles that start to get irritated. And so they can start to understand that these chronic emotional behavioral responses to these stressful situations can actually cause symptoms that cause those muscle tensions that cause your neck to ache, your head ache, shoulders to ache, or your whole body might tense up. And we also know that when we get nervous, we get abdominal symptoms, right? You get butterflies or you get pain in your stomach like this. And again, acknowledging to the patient the importance of that is sort of the second phase. And then, of course, the third phase is okay. Now, now that they understand all that and they start to believe that, then what do you do to, let's say, reframe those thoughts or change that cognitive disruption, right? And so there are techniques, as you know, things like cognitive behavioral therapy and such that helps with those. So if you have a patient with migraine, yes, I have no problem giving them medications to prevent migraines, medications to treat it, maybe even things to help them sleep or antidepressants. That's all fine, but it's not getting at the root cause. While they're on those medicines, I believe these patients, in addition, should have some kind of mental health evaluation, counseling, therapy, as well. Now, one of the things, I'm not trained in CBT or as a counselor, so I tend to use some simple reframing techniques. Gratitude, I find to be incredibly powerful and incredibly easy to do if you choose to do it. And that's the choice is a whole nother thing. But if we had to boil down the concept of gratefully well into one word, I think the word is choice or choose. That is, patients have to become their own advocates, healthcare advocates. They have to be willing to take some responsibility for their own health care and make the changes, the lifestyle changes that are necessary to help them. They can't just, go to the physician. And in Western medicine, we tend to put all the responsibility for a patient's care on the physician's shoulders. So you come in with migraine headaches, the physician wants to help. You want them to figure out what's going on. You want them to fix it. And the only thing they can do is give you medicines. They can't do anything else. There's nothing else in their toolbox. So you have to be willing to take some responsibility for your healthcare. You might take the medicines, no problem with that. But in addition, you have to get to the foundational, to the root issues of these and find out, what to do with that. And again, gratitude, I find to be, many ways to do gratitude. The way that we promote it, well, I mean, one of the things, there's no right way or wrong way to do gratitude, but a very effective technique is what I like to call the gratitude traceback method, or intentional gratitude. So I wrote a book about called Holistic Health Pathways, and in that's about the physical and mental health benefits of gratitude. And there we try to teach some techniques of gratitude besides gratitude journaling. Gratitude journaling is very popular, very good, no problem with it. But there are other methods of practicing gratitude that I think can even be more powerful.
That is so fascinating, and I actually really feel that it is so empowering to realize that our thoughts, they aren't just influencing our health, they are the very part of it. And you talked about gratitude, and gratitude, it sounds simple, it is maybe even considered so soft, but in your experience, what makes it such a powerful intervention? Also, you talked about that there are ways in which, gratitude can be shown. So, how can something as emotional as thankfulness, how can it lead to measurable changes in physical health of a person?
So one of the things that attracted me to gratitude was um, the idea that when I saw that there was actual evidence, studies that were done that showed the beneficial effects of gratitude, both on physical health and on mental health as well. And so if you go and look at the literature, there's actually a ton of literature, a lot of studies that are done on gratitude that show these physical and mental health benefits. And so when I saw that, that was very intriguing to me. And so I started to use it personally, and then it sort of overflowed into my practice. And so the thing that is, I think, a little bit challenging with the gratitude journal, is that um, with gratitude journaling, you have to sit down, you have to have a journal, you've got to take some time, and you have to write down, 3 or 5 things or whatever on a daily basis. of things you're grateful for. That's fine. There's studies that show it's effective and all that. But, it's hard to measure what I like to think of as the quality of the gratitude. So let's just say, you're going to bed at night and you're supposed to do your gratitude journal every day and you forgot to do your gratitude journal that day. And you go, oh, I didn't do my gratitude journal. And so you get up and you get out your journal and you write, oh, I'm grateful for my family and I'm grateful for my job and, whatever. You quickly write down, um, you know, 3 or 5 things or whatever. Well, there may be some effect to that. I don't know. But it's not that what I like to think of as awe-inspiring gratitude. And so, and plus you have to take the time to sit down and you have to have the journal. You have to take the time to sit down and do it. With the methods that sort of I like to think about, like this traceback method, these are methods that you can use what I like to call on the fly, right? In the middle of a situation when you find yourself having a negative emotion. And the degree of the negative emotion is not important. It could be, you don't have to label the negative emotion. It could be irritation, frustration. You could be a little bit peeved. You could be anxious. You could be angry. You could be full out rage. Doesn't really matter. You find that you're experiencing a negative emotion. So now you can, with this method, you can stop and you can make a choice. And that choice is, do I continue to be angry or, full of rage or irritated or frustrated with this situation? And there's no judgment here. There's no right or wrong. If you want to continue to be frustrated with the situation, now at least you made the choice to do it yourself. You're doing it to yourself as opposed to blaming the situation. And so just that alone actually lessens the intensity of that emotion, believe it or not. But that's one choice. And if you choose that, you're still going to have some degree of whatever negative emotion, maybe less, but it'll still be there. But it's a choice. You could also choose to try to reframe that situation and look at it in a different way. You can give the person the benefit of the doubt. That's one technique. Or you can find something in that moment to be grateful for. And so just the other day, I was in the grocery store and, I got in the slowest line and, there was a guy in front. I use this example all the time, but this happened to me. There was a guy who was having trouble with his credit card at the grocery store and it wouldn't work. And the cashier couldn't get it to work. And they had to call the manager. and whereas in the past, I would have gotten frustrated with this. I was in a hurry or whatever. I started to laugh. I started to chuckle because I said, here's the situation that occurs to me, like that I use as an example. It's occurring to me here as a, in the flesh. And I started to laugh. And so that frustration or that, anger, whatever it was, quickly changed to, a positive emotion. I was actually laughing about it. But importantly, again, if you look at the studies, there's very good evidence that gratitude, there are physical and mental health benefits to gratitude.
I totally, totally agree with you. And it is actually so incredible that the thing which is so accessible to us, it can ripple through the nervous system, the hormones, and even the heart health. Thank you for sharing that with us and the insights that you've given. Also, for someone who is listening right now, and maybe they are stress or as you said emotions that are either burnout or the chronic illness that they're going through, how can they start moving from feeling like a passive patient to becoming an active partner in their healing? And yeah, what do you have to say to them, and what steps should they take to start today?
Yeah, it's a great question, and can be challenging when you try to relate this to people. I think again, you have to get them to understand. It doesn't matter what the symptoms are or what the illness is. It could be migraine headaches, which are, all medically unexplained symptoms. But in addition, it could be a chronic illness like diabetes, as an example, right? Diabetes is a great example because it's epidemic in this country, in the U.S., um, and and it's a lifestyle issue. Yes, you do have to be genetically predisposed, to develop diabetes, but you can modify the expression of those genes based on your beliefs and based on your lifestyle. And so it's important to get people to understand that. So I think the first thing that has to happen again is as you explain these things, people have to be willing to take responsibility for some part, not a complete part, but for some part of their own health and health care. If they're unwilling to do that, this method's not going to work. It's just simple as that. And again, without judgment, if you have migraines and you're not willing to make those changes, if you have diabetes and you're not willing to make those lifestyle changes, then go to the physician, get the medicines, because the medicines do help. The medicines do help prevent migraines, or they treat migraines, or they help with diabetes and complications of diabetes. So it's fine. But they're not going to get to the root cause. You're going to rely on your physician for the rest of your life because these drugs, remember, are not curative. They're treatment. So you'll have to buy them, take them every day, buy them every month for the rest of your life. Right? If you're unwilling to make those changes, again, I'm not saying there's a right or wrong here, but getting people to understand that, hey, if you want to get to the root cause of these things, then you have to take some responsibility. So I think that's the key to get people to understand. And then
Mm-hmm.
the second thing in addition is showing them the power of thoughts, showing them the power of beliefs, how, there's a physiology to those, to mindset and beliefs and thoughts.
I totally agree with you. And yes, thank you for sharing those insights with us again. And yeah, to our listeners, what if your healing, it wasn't just waiting in a pill bottle, but it was already, pulsing you in your perspective. Dr. Julius Torelli reminds us that we are not just patients, we are partners in our body's story. And I hope you resonate with it and you take in the advices and the steps that he has shared with us today. Also, through mindset, presence, and deep gratitude, wellness becomes not just possible but powerful. We've discussed all of these points so beautifully. And so, if you take one thing from this episode, let it be this: healing starts with what you choose to focus on today. Thank you, Dr. Torelli, for sharing your wisdom. And thank you, beautiful souls, for tuning in to Healing Horizons. I am Pragya Malvia, and until next, keep expanding your horizon and keep choosing gratitude. Take care, and I'll see you in the next episode. Thank you, Doctor.
Thank you. I appreciate it.